cardiology, we don't use that much of embolization device material, but sometimes emergencies or relative procedure we come across and we have to forced to do it, and except the uterine artery embolization, where some of centers are regularly doing it. Now the topic is open for discussion. My first question is Dr. Raj Patel. So, what is your experience with antegrade perfusion? That is, you said return cannula in VA, ventricular artery ECMO. And if the procedure is short and other condition like Imbella, do you think we have to use it, or when do you use it? After how many hours of the procedure? Suppose prolonged support, then you have to use. So when do you use exactly the cannula, return cannula? Yeah, unmute. Please unmute.
Yes.
Yeah.
Can you hear me now?
Yeah, we can hear you very well.
Yeah. So thank you for the questions. So the question is, when do we use the antegrade perfusion system?
Yeah.
And so when we place the retrograde micropuncture access with a 4 or 6 French sheath, we assess the size of the artery. And if there is any doubt about being able to perfuse around whatever the large bore access is, whether it be the 14 French Impella sheath, the 17 French tandem sheath, or even larger cannula for ECMO, if there's any doubt that there'll be perfusion around the large bore access, then before placing the large bore access, we'll place the antegrade perfusion, because one, it's very difficult once the large bore access has been placed to place an antegrade sheath around it. And two, if the limb does become ischemic, especially once the patient has left the cath lab, dealing with limb ischemia in the ICU is very difficult. You know, it really, as our vascular surgical colleagues can attest to, if these patients develop a compartment syndrome and require fasciotomy, their morbidity is significantly higher. And as I mentioned during my talk, if the patient ends up getting an amputation because of this and they survive the shock, well, it's just devastating for the patient. So prevention is key.
So my next discussion, I think Dr. Amarish is a very good video and well explained the technique, and we are using it whenever we use for large femoral sheath. So my question is, if you are planning for antegrade puncture, do you use this? And a calcified vessel, what is your experience, femoral vessel?
So the thing is that this can be used wherever you're able to provide a 45-degree angle to the vessel. Now, it's entirely possible that in case you're doing an antegrade puncture and there's a large abdominal panniculus, you might not be able to enter the vessel at a 45-degree. You know, if the abdominal panniculus, the apron is kind of hanging over, and it can actually, you will not get the correct apposition of the foot pedal. So if the geometry and the anatomy are suitable, you can use it. We've used it in, you know, a variety of vessels. We've used it in the carotid. We've used it in many areas. But that's the only thing. If you feel that your angle of deployment is going to be difficult, then I would suggest that you shouldn't.
So, any other questions? Anything?
Dr. Shugan?
Like to discuss? Yeah.
So Dr. Adiraju is online.
Yeah. So now we'll move on to okay. So next session by Dr. Adiraju. Invite him for his talk. I think we had a discussion earlier in the evening. Dr. Adiraju, please.